Tonight, the city's top doctor renewing calls for tighter restrictions as COVID-19 cases climb in Toronto.
We need to take actions that protect the greatest number of people.
I can't make a willy-nilly decision.
Doug Ford defending his government's decision not to shut down more businesses, saying it would put thousands of people's livelihoods at risk. Plus,
so it's me with a cat. There's been lots of baking and crafting.
The impact of isolation. As officials urge people to limit social contact, we look at how this affects those who live alone. And a special ceremony for some furry friends. Why one church chose to bless GTA pets during these tough times. Good evening, I'm Talia Ricci. As thousands of Ontarians struggle to get an appointment to get tested for COVID-19, Premier Doug Ford is defending the system as the best in the country. But the backlogs at assessment centres and labs have some worrying that people are spreading the infection before they know they have it. Here's Queen's Park reporter Mike Crawley with the latest.
The spots at this COVID-19 drive-through testing site today are precious. The province is trying to shrink its testing backlog by shrinking how many tests are getting done. The impact? If you've just started showing symptoms of COVID-19 or you've just learned you've been exposed to a confirmed case, you won't likely find out whether you're positive for the coronavirus until the weekend.
It certainly makes our ability to slow the spread more challenging.
This morning, arranging a test for today or tomorrow was all but impossible. Assessment centres were either fully booked, closed, or had no slots till Wednesday. Thousands of Ontarians are struggling to get an appointment.
It's certainly alarming to also know that it's difficult to get tested to begin with, let alone to have your results.
There's a backlog of nearly 70,000 tests at the province's labs. That means once you finally do get tested, the turnaround time for results is at least 2 days.
If people don't get that confirmation that they're positive or negative, they may get frustrated and then return to work or to socializing or whatever activities.
We needed a greater laboratory capacity than we currently have. And for a variety of reasons, we just don't have that right now. And that unfortunately is probably avoidable.
Experts say the delays will discourage people from getting tested and make it hard for the province to really know how many cases are out there. Despite the problems, the Premier is boasting about Ontario's testing system.
Talk about success. We're hammering the whole country combined. All the provinces combined can't even keep up to us.
The latest national stats do show Ontario conducting more tests per capita than any province except Prince Edward Island. However, the rate of new infections here is higher than everywhere except Quebec and Alberta. Mike Crawley, CBC News, Toronto.
Tonight, it seems the website where people can access their COVID-19 test results is down. This is the message that pops up when you visit the page, saying the service is down for maintenance, and to obtain your results, you should contact the clinician who ordered your test. According to some reports, it's been down since this afternoon. The government has not yet responded to requests for comment on how long the shutdown will last. Nearly half of the new cases today come from Toronto. And as the city struggles to keep up with the increase, Toronto Public Health suspended some contact tracing. But the province says more tracers and case managers are coming, with 200 being assigned to Toronto. Angelina King reports.
COVID-19 is spreading in a serious way.
Dr. Eileen Davila says the situation is so bad, the extra bodies for contact tracing just aren't enough.
To be frank, I expect we could have another 700 people added to the ranks and still be unable to contact trace with the same reach and results.
Full contact tracing will still take place in high-risk settings like schools, daycares, nursing homes, hospitals, and shelters. But outside of that, Toronto Public Health will no longer notify close contacts of people who've tested positive. Instead, it'll be up to the person infected.
Our focus is on case and contact management of the most high-risk cases. We need to take actions that protect the greatest number of people in the shortest amount of time.
To help, Davila renewed her call, asking the province for tighter restrictions, including pausing group fitness classes and indoor dining for a month. The Premier, not there yet.
I can't make a willy-nilly decision and just say I'm closing everything down and ruin thousands and thousands of people's livelihoods and their life. So show us the evidence, hardcore evidence.
But Davila says she has and is happy to provide more.
We have seen clusters and outbreaks related to those particular settings.
When it comes to scaling back contact tracing, this epidemiologist says it means losing control of the pandemic.
Contact tracing is a really, really important tool in public health to make epidemics go away, or at least to constrain them.
He says it's taught health units valuable information.
There's an added bonus when the city does contact tracing. When Toronto Public Health does contact tracing, they're actually able to collect the statistics, collect the data that tells us how spread is happening.
But epidemiologist Dr. David Fissman says halting some contact tracing is the right move right now.
We can't possibly be in touch with case contacts fast enough to prevent them transmitting infection to other people.
When it comes to partially suspending contact tracing, Dr. Davila says the public health unit will move back to its previous approach as soon as cases are lower. Angelina King, CBC News, Toronto.
Donald Trump has checked out of the military hospital where he was being treated for COVID-19 and is now back in the White House. The president's medical team is reportedly working with an infectious disease specialist to ensure Trump doesn't infect others in the White House. Trump was admitted to the Walter Reed Medical Center in Maryland on Friday.
I don't know what damage this could be causing me either today or for the long haul.
This woman from Bolton is going public after doctors discovered a 5-centimeter-long needle left in her spine for more than a decade. Her story coming up. The Ontario government announced funding today to keep schools open during the second wave of COVID-19.
The government is acting and investing an additional $35 million to protect schools in higher-risk communities of Toronto, of Peel, Ottawa, and York. Our government is investing more to reduce the risk.
The education minister says the $35 million will be for schools to hire more staff and improve online learning. The money is part of the government's more than $1 billion school reopening plan. A North York Catholic high school is temporarily closed after a staff member tested positive for COVID-19. St. Charles Catholic School on Claver Avenue will stay closed until Friday. The staff member who tested positive was also assigned to 4 other schools in the board, including St. Demetrius, St. Mark, St. Roch, and St. Ursula. The Toronto Catholic School Board says the closure is out of an abundance of caution. As of Friday, 318 schools across the province had reported at least one confirmed case of COVID-19 in students or staff. Toronto Public Health is urging people to limit social contact to those within your household. But what if you're the only one in it? As Nicole Ireland reports, this is a big worry for the many people in the city who live alone.
Stephanie Belding's daily walks have helped her get through the last 7 months of COVID-19.
I'm on my own, so it's me with a cat. There's been lots of baking and crafting.
But a key part of her well-being has been the bubble she formed with another single neighbor in her building.
I cook a lot so we can share meals or we'll watch stuff together.
And it gives them a sense of normalcy.
Just knowing that I have someone in my immediate vicinity that I can kind of have a relationship with that isn't 6 feet away and masked.
But as the number of COVID-19 cases climbs, Toronto's medical officer of health is urging people to limit contact with anyone outside our own households. An alarming prospect for those who already went through the spring lockdown on their own.
When you live alone, you know, when you say a household and you're the household, the thought of not being with other people for an extended period of time or an indefinite amount of time is overwhelming.
According to Statistics Canada, more than a quarter of Canadians live alone. That percentage is even higher in Toronto. Single-person households make up almost 1/3 of people living in the city. There's been a lot of attention focused on the enormous stress facing parents and families during the pandemic, but this psychology professor says it's also important to remember that people who live alone are trying to get through a crisis without the normal supports.
The natural response we have to stress or threat or grief or any of these negative emotional states is to connect with another human being. And given the choice, we connect with them literally physically.
There was some hope that public health might provide specific guidelines to ease the burden. In a letter sent Friday to the province, Toronto's medical officer of health suggested flexibility that would allow people living alone to see up to 2 individuals for social support. But when CBC News asked Dr. Eileen de Villa about that at a news briefing today, she didn't answer directly.
And I'm asking people to really try to focus on, limiting interaction with others outside of your household to those things that are true needs.
That leaves people living alone, wondering what life in the coming weeks or months will look like. Nicole Ireland, CBC News, Toronto.
Video of Adam Strong's police interrogation was played in an Oshawa courtroom today. Strong is charged in the murders of teenagers Rory Hachey and Candace Fitzpatrick. At one point in the video, family members of the murdered teens got up and left the room. And a warning, the story contains graphic and disturbing details. Ali Chiasson reports.
The interview with Adam Strong was conducted by a 30-year veteran of the Durham Regional Police Force, Detective Paul Mitten. Some parts were mundane, and then all of a sudden Adam Strong would say something to the detective that would cause Rory Hachey's family to squirm in their seats or storm out of the courtroom. One of those moments was when Strong brought up rumors that were circulating in jail. Quote, "There's some nasty rumors of me feeding Rory Hachey to homeless people. Is that true? Is that circulating?" Detective Mitten says he's not sure, but, quote, "people were wondering how her parts were disposed of." They talk about how Rory's torso was found in the Oshawa Harbor, floating, to Strong's surprise. Quote, "The torso popped up." Strong says, quote, "No, it didn't pop up, did it?" And then the detective brings up how a grandfather and grandson found the torso. Strong says, quote, "I felt bad about that." Strong then brings up more jail talk. He says another inmate made mention that Rory Hachey was his sister. And that caused Adam Strong to burst about Hachey's family in the video saying, quote, "Where were you when she was expletive for food?" That's when the family stormed out of the courtroom. Before court wrapped for the day, one final gruesome comment from Strong, admitting that he flushed her organs. Quote, 4 months ahead of time. The video is 11 hours long. We only got through the first part of it today. Court continues for the rest of the week, and every day, Candace Fitzpatrick's family and Rory Hachey's family will be in attendance. They say no matter how gruesome it gets. Ali Chiasson, CBC News, Oshawa.
There's a call tonight for the province to declare a state of emergency over homelessness in Toronto.
There's a huge escalation in thefts and vandalism and assaults, public needle use and defecation and intoxication. We've seen people being resuscitated on the streets. Our overall quality of life as residents has really deteriorated quite a bit. It's not fair to us, and it's not fair to the folks that live in the tent encampments.
Last year, the Ford government quietly cut $2/3 of $1 billion from the Ministry of Housing's four-year housing budget. This money should have been going towards safe housing, potentially working to avoid some of the trauma, sickness, and death that the encampment residents are facing every single day.
Business owners, advocates, and area residents gathered in Alexandra Park near Dundas and Bathurst today. The park has become an encampment where around 100 people are now living in tents. There's growing concern that people camping here could die as the weather gets colder. Area store owners say the situation is hurting local businesses. All of the people at today's press conference want the province to create more affordable housing and provide better addiction and mental health support.
Well, Monday was a good start to the week in terms of the weather. I'm meteorologist Colette Kennedy. Why don't we dial it up and make Tuesday a little bit better? I'll have your forecast coming up after the break.
When a Bolton woman sought medical attention for shoulder pain, she discovered she had a 5-centimeter needle lodged in her spine. She says there's nothing she can do about the needle or about getting answers from the healthcare community. Rosa Marcatelli has that story.
When the pain started in her shoulder and right leg 2 years ago, Giovanna Ippolito chalked it up to getting older, until an X-ray showed a 5-centimeter-long broken needle in the 46-year-old's spine. She believes the needle broke off either during the birth of her son in 2002 or daughter in 2004, when a spinal block and epidurals were done. After all, how else did it get there?
I can't even describe how I feel. Like I said, there's a fear every day.
It took more than a decade to uncover the medical error, after staff at the time didn't report it or didn't realize it happened. That discovery was the beginning of a frustrating 2-year battle. Ippolito says hospital officials handed her more than 170 pages of her patient records, then told her there was no record of the needle breaking, so there's nothing they could or would do. The College of Physicians and Surgeons of Ontario can't launch an official investigation because it's unclear which doctor is responsible. And a lawyer told Ippolito malpractice cases are nearly impossible to win in Canada.
I got zero accountability.
Ippolito just wants answers, but says getting them seems hopeless. Ippolito is one of more than 130,000 Canadians hurt by the medical system every year. What's needed, say advocates, is a new way of dealing with these situations, a no-fault compensation system like they have in New Zealand, France, and other places, where patients are compensated quickly and fairly without having to go to court.
I think we have a lot of work to do in Canada to change the way our system works, stop with the finger pointing, get no-fault insurance in place.
The hospital in Ippolito's case wouldn't talk about her situation specifically, citing privacy concerns. Generally, it says its processes include case reviews and are accompanied by open discussion with patients, families, and/or caregivers as it relates to complaints about medical errors. Ippolito says that didn't happen for her. Now it's her future she's worried about.
I don't know what damage this could be causing me either today or for the long haul. So it just is, it's a feeling of fear, a feeling of the unknown.
That needle is there to stay. Doctors say it's too risky to remove. Rosa Marcatelli, CBC News, Go Public.
City crews are just days away from ripping apart an outdoor rink at Dufferin Grove Park to make way for a new one.
Where are people going to go to have the release, the escape that they need, or the exercise, or just this bare social interaction?
The community says the rink is a hot spot for residents all winter long. Construction on the new rink was meant to start this spring, but plans were pushed back because of the pandemic. The city says there are too many safety concerns with the current rink to reopen it. The city will add a natural rink to the area, but it can only be used when the weather drops below zero. A partly cloudy evening tonight with that slight fall chill in the air, but more warm weather is on the way. Let's bring in Colette Kennedy with the forecast. Colette, October is off to a good start.
Thank you, Talia. Well, you know, sometimes fall just gives you some of these gifts, and we're receiving one when it comes to the weather. And we look at this week ahead, and what better than when we're going into the Thanksgiving weekend. So we had a nice day today. We've got a nice day coming up, maybe even better when we look at the temperatures. It is just going to be a little bit breezy. The wind's a little gusty as we go into the afternoon hours. Now, Wednesday, it will be windy, and we do have a chance for some showers, but that's okay. Temperature's still looking pretty good. And overall, it is going to be, if not seasonal, the temperatures, the highs a little bit above seasonal, and even the overnight temperatures on the mild side, with maybe just the odd exception. So today, even those readings were pretty decent. When you have the sunshine, even if they're a little bit below seasonal, it's pretty nice to have, and it makes it pretty easy on a Monday when you've got some sunshine coming through. So we had a nice Monday today, and just looking ahead, that ridge of high pressure, that is responsible for the clearer skies that we get in between with some of the cloud cover here and there, but that's fine. You can see the precipitation up here towards northeastern Ontario as the front goes through, and some of the cloud cover associated with that. And rolling this ahead into Wednesday, most of the moisture will be towards the north, and the morning hours could have a few sprinkles. The greater chance will be into the afternoon of getting some of those showers coming through the GTA, but really by the time we get into the evening, that all pushes onward. So it's kind of that one day where we're likely to have the wet conditions, and then things dry out once again. again. So just sort of midweek is what we'll be watching here. Overnight tonight, these are those temperatures that are above seasonal for southwestern Ontario. The wind's kind of picking up here a little bit earlier, and then the gusty conditions through the day as we go through Tuesday. Average high 18, and look at some of these temperatures for you on Tuesday. So really looking nice, even if the skies will be a bit variable, meaning that at times you'll have more cloud cover than at other times more sunshine. The readings tonight, I know over the weekend we had some of those temperatures dipping and this frost risk, and at times some frost. So nice to see some of these temperatures holding on, and it makes it better in the morning too, that you don't have such a cool start. And then into the afternoon, the southwesterly winds, these gusty winds, are also what kind of help the temperature to go up. Now spots like Oshawa, because they're kind of coming in off of the lake, it may keep your temperature down just a tiny bit there, but still seeing these readings a little bit above seasonal. And this is what I want to kind of show you. Into Wednesday, with that front going through, we will see the showers and the temperature dip down a little bit. Behind it, perhaps a little bit cooler, but the sun comes back out into Thursday. Now, as we go towards the holiday weekend, that's still a few days out, I'm going to be watching it carefully. You see Saturday, I've got the temperature going up into the low 20s. Some of the models want to bring some showers in, though, for Saturday. So let's just give it a couple of days before we get too married to what's happening there for the weekend. But all in all, a mild week ahead in general, Talia.
Looks great. Thanks, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
It's a time when people can feel isolated. So St. Michael and All Angels Church on St. Clair West recently took their service to the streets. They held a special blessing ceremony this past weekend, but it wasn't their regular congregation.
Father, and of the Son, and of the Holy Spirit. Many churches really throughout Christendom are blessing animals on St. Francis Day as a reminder of, first of all, the gift that pets are to us, that they bring us enormous comfort, enormous help and joy, particularly I think at this time in COVID, where sometimes we're really alone, but the pet brings that sense of hope.
The celebration marked the feast of St. Francis of Assisi, the patron saint of animals. The church says it's a well-loved tradition to bless animals to mark the day, dating back to the Middle Ages. And that's our show for you tonight. Thanks for watching, and I'll see you back here tomorrow night at 11. Good night.